Examples like Hinchingbrooke Hospital in Huntingdon, which is on the verge of being privatised due to a decision you took as Health Secretary, make me doubt whether you're the right candidate. Would you reverse this decision if you became Prime Minister and bring all hospitals and NHS services back into true public ownership, run for the public by the NHS?
Well, let me first explain my approach on the use of the private sector in the NHS before I deal with the specific example. As Health Secretary, I changed the policy in the Labour Party on the NHS's use of the private sector. It was called NHS Preferred Provider, which was that where we were changing NHS services, the NHS, the public NHS, should always have first chance to bid. And for me, the public NHS must always be the backbone of health service provision in this country. And when I put forward that policy, I didn't have a great deal of support from many of my cabinet colleagues, but I have got the strength to do what I believe is right. And it occurred to me that for 10 years, the government had sent out a message at times that it was a case of public bad, private good in the NHS, and that had demoralised NHS staff. So that is why I made the change to NHS Preferred Provider. But indeed, the example of Hinchingbrook was consistent with NHS Preferred Provider because the hospital had been failing. It needed a new management, and the only bid that was received was, as if I remember it correctly, from the private sector. It was a decision taken at local level by the local health authority and the strategic health authority, and it wasn't actually a decision that was taken at a national level. Obviously, I was aware of it at the time. So it was consistent, but the overall policy change I brought through, the change to the NHS Preferred Provider, I think should build the confidence to the questioner that I've got my priorities in the right place when it comes to securing and preserving a public NHS for this country for many decades to come.